Excellent. Welcome, everyone, to our next episode of Beyond the Badge. It is my pleasure to welcome you and host this episode. I'm Steve Fecto from Talent Development and Learning. I'm joined backstage by my support team from our Spotlight Committee. They're the ones who are going to be presenting stories. They're a lot of our leaders in patient experience and employee experience across our health system. They're very busy this week with Patient Experience Week that I hope you're all enjoying and attending the great seminars that have been happening throughout the week. There are committee members who are going to be sharing stories with you today, and also my team backstage, Michael Joseph, Jessica Rubin, and Alyssa Gianandrea, who are supporting this show that we are so happy we could have you join us for. Here, our episode 3 of season 4, our 4th year of sharing Beyond the Badge stories. Before I start to introduce our special honorees for today, some background from the many of you who are brand new, or this is your first time because you happen to know someone who's being honored today. It's your first time joining us at Beyond the Badge. And these stories that we're going to share today come from a very special place. Every single day, there is a system daily huddle where our most senior leadership from across our large 48,000 employee health system come together for a huddle to make sure overall across our system, we're ready for a safe, high quality, excellent day for our patients and for each other, and across all of our many facilities. And each day there's a pause where one leader has their one chance to say, it's my turn. I get to share an employee story today. What's the story I want to share? They come from patient letters. They come from star peer-to-peer appreciation messages that are just outstanding. They might be some remarkable story that occurred that they caught wind of and said, oh, I've got to share this story. It's so remarkable. Or just spotlighting some incredible work that they wanted to shine the light on and share with this audience of their peers, our senior leadership in our health system. And the stories and the people that we're honoring today are those individuals who are recognized on that system daily huddle. And we really appreciate our colleagues who lead those huddles, Joseph Mary, Swati Garg, Hillary Pauly. They collect all of those stories from the previous month. So we're looking at the March stories from the huddle. They collected them all. They sent them to us so that we can share with them, with you, their family, their friends, their colleagues, their leaders on Beyond the Badge. So for all of you who are new, my team, I know Alyssa, I believe, has already been posting in the chat our program for today to follow along. There's also a resource tab you can follow along, and I encourage you to be a part of this celebration. Make it a party, use that chat, cheer on people, send it to everyone, and allow your praise to be seen by the full group. I also know that our regular audience, who's come back month after month after month for now our 4th year, is that senior leadership community and our department heads and leaders from around our health system who come each month to be re-inspired by hearing from our colleagues who are doing such exceptional work. And they just love it. And I'm always so proud to see such a great leadership presence in our audience. I always start by calling on a couple just to welcome us, let you know they're out there, and say hello and hear what they're looking forward to today. So I've spotlighted a couple here. I want to go first to Emma Palmer, who's a big fan of the show, come to so many episodes. Emma is our Chief of Staff to the CEO and our Executive Vice President for External Affairs for the health system. Emma, thanks for being here again. Love to give you a chance to say hello to our audience.
Thank you so much for having me. This is the most fun when I get to come here. So thank you again and welcome everyone, especially the families who are on the call today. This is just a really special moment. We are working really hard to become what is used a lot is one Mount Sinai these days, which is no matter where you work, no matter which department you work for, we're all part of this larger one Mount Sinai. And I think moments like this is when we really get to encapsulate it. So thank you for being here. I think it's why we all sort of started to come to work here, at least for many of us, is sort of the mission and values of Mount Sinai. And we hear it so hard in these stories, the compassion, the kindness. I just want to say thank you. Without the work you're all doing, none of it stands on its own. So it's really because of the incredible work. So thank you, and keep it up. And we're all here to support you.
Absolutely. Emma, thank you for calling that out about the One Mount Sinai. I absolutely agree. I know our audience loves to hear, and our celebrants love to hear. They say, this is what it's like in our department or at our hospital. And then they hear stories that say, oh, those are the same values. That's the same commitment that we make at our organization, our site. as they're making there. They all have that "we find a way" and a brand promise in there, our many values that I'll be shouting out with my own signs as I hear them. But you're right. It really helps us see that Mount Sinai, no matter where you are in Mount Sinai, we believe and follow those same principles and values, which is wonderful. Another leader I want to call on is Dr. Julian McGreevy, who I know is out there today. He was our chief medical officer at Mount Sinai. Beth Israel is moving on to some exciting new work for our One Mount Sinai Health System. Dr. McGreevy, I'd love to give you a chance to say hello and welcome our audience.
Thank you, Steve. Happy to be here, and thanks, Emma, as well. Just want to thank all the colleagues for being here, for the honorees, for the work you do to be recognized, and for your families for supporting you. As Steve said, I've been the chief medical officer of Mount Sinai Beth Israel for the last 8 months. And I think, as people know, it's a really profound time for a very storied institution, a profound time for a health system. And I think it reflects a profound time for healthcare as a whole, where we need to think about how we transform the way we deliver care, how we meet patients where they're at. And I think about the stories from the last months, and two that stand out. One is a story of security officers, going out onto the street and helping people that needed help. And another is, one of our employees going above and beyond to try to figure out who somebody was and who was out there, who loved them and was looking for them. And I think about those stories and I'm inspired. And those are the stories that keep us going when we think about the grace and the distinction with which our colleagues serve. And we think that we can do that too. So I can't wait to hear the stories of our honorees today. The other thing I'd like to say quickly is, so I'm an emergency physician. I also do clinical ethics for the health system. And I think a lot about a phrase that's really important in medical ethics, and that is that medicine is a moral enterprise. And what that means is that we have one job, and our one job is to do the right thing, to do the right thing for our patients, to do the right thing for each other so that we can love our work and then, again, do the right thing for our patients. And so I look forward to hearing the stories today of our honorees doing that, figuring out what the right thing was and going above and beyond to do it and to serve our patients and to bring us all together as one Mount Sinai. So thank you for the opportunity to be here. I can't wait to hear the stories.
Oh, thank you so much. And to our audience and to our celebrants, you hear he's referencing stories from last month's episode that left an impact from hearing them last month. Your stories are really unique. And that's why what's so exciting about our huge population, our 48,000 employees, there's always something remarkable happening. And this month, this collection that we're about to share are just these remarkable, unique stories of individuals who for the first time are coming on to Beyond the Badge, but are doing this great work every single day. And we're so happy we could share them. I know you're going to have a couple more that you're thinking about often, Dr. McGreevy, as we go into the next month. So with that, let's jump into the stories. Now, this is a health system. Not everyone can step away. I might jump around in the order. I know right off the bat, we have a couple of our physicians are in OR today, are in the emergency room today. They're looking for an opportunity to step away and join us. There's also 5 stories in writing in your programs that I want to call your attention to. Once we're done with today's episode, go into our program that you see there. They weren't able to make it, but many of them expressed appreciation and thanks for being recognized, submitted responses to their story, and you can continue the good vibes and read those stories in our program. They're excellent. With that, though, I do want to jump into who is here. I'm going to start with the appreciation by the Stories of Excellence section. This is a section where these are one-time events of really remarkable stories. I love to go to these first. So Andres, I'm going to call you up. The first one comes from Mount Sinai Morningside, and it's for Russell Gamboa, a really great story around safety. And hey, Russell, we're gonna turn it to Andres for this one to start us off.
Wonderful, and good afternoon, everyone, and congratulations to all the celebrants. So recently, 2 colleagues wrote to share an example of how senior occupational therapist Russell Gamboa showed professionalism and awareness to ensure a patient's safety and prevent injury during a very difficult situation. Russell was assisting a difficult and combative patient in the hallway, and when the patient slipped, Russell was quick enough to literally catch the patient securely and safely, even while the patient was verbally aggressive with him and surrounding staff. This prevented a head strike and further injury. With assistance from colleagues, Russell was able to get the patient back to a standing position and make sure the patient got back to his room safely. Russell showed extreme professionalism and quick thinking to ensure patient safety.
Yeah, there you go. Patient safety is our lead here today, always our first value. And Russell, both colleagues highlighted how your actions ensured that patient safety. So can you tell us about your experience during this challenging moment, but also how you always keep a focus first on patient safety, even in these difficult situations like this.
Yeah, sure. It actually happened during like the floor round. So everybody was around the nurse's station, and this patient just walked out of the room screaming, just being angry. But I can tell he was unsteady.
Yeah.
And out of the corner of my eye, I just paid attention. And as soon as I saw him tilt back, I knew he was going to fall. I just bolted and just caught him right before he hit the floor. We helped him sit down on the ground. Then my colleagues finally came and we picked him up and stand him up so he could sit in a chair. He was very appreciative, actually. He became more cooperative after that.
Wow. Yeah, I'll bet. And a great example of our teamwork value too. It sounds like you were the onlooker in this situation. Came out, someone was addressing him. You're like, I'm supporting, I'm watching for other cues. I'm noticing the instability of their walk, and you were ready. That awareness had you ready in that moment to jump in as needed, supporting your colleagues and supporting the patients. So excellent awareness and support of your colleagues throughout that situation. Yeah, remarkable.
Yeah,
Thank you
thank you.
so
That's
much.
how we try to do it.
Yeah, always try to do. Absolutely. Thank you so much, Russell. Great catch. All right.
Thank you.
Thanks, Andres. We're going to come back to you. I know we've got some more stories later from West and Morningside that Andres is representing today. Let's go to Colette Watson next from Mount Sinai Hospital. Has this really, really remarkable and wonderful story for Rebecca Brownsword, a social worker out at Mount Sinai Hospital. So, Colette, let's go to you and let's bring Rebecca on up as well.
Great. Thank you so much, Steve, and congratulations to Rebecca and all the celebrants here today. So her story reads, as one of her oncology patients was actively dying, social worker Rebecca Brownsword dedicated a significant portion of her day to spending time with the family and providing invaluable emotional support. Rebecca also extended herself to provide support to the patient's young son during this difficult time. Even though the patient had transferred to a different unit and team when he transitioned to comfort care, Rebecca prioritized continuity of care to extend empathy, compassion, and anticipatory bereavement support to the family. This situation exemplifies Rebecca's consistent dedication in providing emotional support during end-of-life bereavement situations, something that she always does with intention, thoughtfulness, and clinical excellence.
Yeah, excellent. Thank you, Rebecca. Wow, the empathy on this story. The author of this recognition story really pointed out your consistency in providing that emotional support with intention, thoughtfulness, and clinical excellence. And I'm wondering if you can share with us a bit about your personal approach that guides your interactions with patients and their families through this very emotional, very challenging end-of-life care.
Yes, thank you. It's wonderful to be here. Thanks for your question. It's a privilege to be able to support patients and their families throughout their cancer journey, and sometimes, in the most devastating of circumstances, bear witness to their passing. As a social worker, I know there's no one way or right way for patients and their loved ones to experience death or anticipatory grief. My goal when working with patients and families is to build strong relationships from the beginning so that during extremely distressing times, like the passing of a loved one, they feel comfortable sharing their complex emotions and thoughts with me. I lead with openness and empathy. We often might assume that the sole emotion when someone is passing would be sadness, but I often witness anger, fear, difficulty coping with the unknown, and in some cases, relief. I never assume I know what a patient or a family member is feeling. I ask them and I listen. I'd like to thank the wonderful social workers that I work with, an incredible group of people who I look to for support, advice, and levity, as well as the lymphoma team that I'm honored to be a part of.
Yeah, and I see many of them in our chat cheering for you, your colleagues, and thank you for appreciating them as well. And thank you to all of our social workers out there for the incredible empathy that you show our patients. And I just love what you said. I think we all can learn from that message. If I'm going to be at my best when I'm needed at the end, I need to build that early. From the beginning, I need to be building that relationship, building that trust so that I can provide that exceptional service, when we get to that moment at the end. Really, really remarkable, and I think that's something we can all learn from.
Thanks.
Thank you, Rebecca. Thank you for doing the very important and very hard and emotional work that you do. All right. And Colette, we're going to see you in a little bit later, too. We've got more stories to come from Mount Sinai Hospital. I want to check in if we've got Joshua here. Joshua's working the overnight last night. He's a night shift colleague out there. We got Joshua. Okay, thanks for being awake for us and ready to go. Sorry
How's
to
everybody
bother you.
doing? No, you're fine.
From South Nassau. So we have Olivia McGregor, our colleague from South Nassau, ready for this story for Joshua Pete's Butcher that I just truly love. So Olivia, I'm going to let you share.
Thanks so much, Steve. And Joshua, I'm so happy you were able to join us.
No,
During a
anytime.
recent snowstorm this past winter, patient transporter Joshua Pete's Butcher kindly offered to provide transportation to colleagues who were experiencing delays with public transportation due to the snow. Even though the snowstorm occurred on Joshua's day off, he picked up and drove two colleagues to work to ensure they made it to their shift on time and that support for our patients would not be impacted. Additionally, upon arrival, Joshua offered additional support to the evening supervisor. This gesture is reflective of the teamwork and supportive environment within the transportation team. We thank Joshua for taking his role of a transporter to the next level to support the team and to support our patients.
Yeah, literal transporter. So we got the big
Yeah.
teamwork there and the we find a way during the storm. I'm going to give
Yes.
you credit for both of those, and I could throw agility in too. But wow, Joshua. I mean, many of us on our day off look out the window at the snow and say, phew, I'm glad I don't have to go to work today. I'm glad I don't have to go out in that. But your thoughts went straight to your colleagues and to the patients that would be impacted. And you
Right.
went out on your day off, braved the elements to support the team, and then chose to stick around and help and see what else you could do. So, can you tell us about yourself, about your team that regularly supports each other, and maybe how that inspired you to step up for your colleagues in this way?
Well, first and foremost, naturally, I'm already outside. I get out of here and I'm already driving or drive for at least 4 hours on Lyft. So already during that time, I stayed purposely for the afternoon so this way to brave the storm. I picked up two patients rather, and from the ER before I picked up my colleagues.
Oh my
And
gosh.
yeah, I had gotten a call from my team lead, and that's what spurred everything. I was literally just dropped off the patient, so I said, you know what, I'm already right here. I'll just bring everybody over. So the way that we work as a team, it just doesn't stop. Whenever a call comes in, no matter what I'm doing, I already finished. I was already in the area. I'm always going to help.
Well, it's just beautiful to say, and you're being modest about it, to have that intent to see what's going on and say, I'm gonna step up and I'm happy to do it. I'm excited to do it. I'm gonna step up. I'm gonna care for
Exactly.
our patients, care for my colleagues. Where else can I help? To be
Exactly.
that person that you can be looked at and say, like, this is a person who steps up to help is just so applause worthy. And we thank you so
Absolutely.
much, Joshua. An incredible story.
Anytime.
I love it. And thank you for being such a true star for your colleagues, for our patients, for everything you do here at Mount Sinai.
Anytime. I love
And
it
out
here.
there in New
Anything for
York
the
for our New
team.
Yorkers.
Anything for the team, honestly.
Beautiful. Oh, well, thanks so much, Joshua. Get some rest. And thanks for
Yes, I'm gonna
joining us
try.
off shift.
Have a great day, all right, everybody.
All right. Stick around. Here's some more stories. We got
Oh
lots of
yeah, I
great ones
am.
to
Trust
come.
me, I already heard plenty so far. It's
All
beautiful.
right, you're going to enjoy the rest. I'm going to go next to, I'm going to have my colleague Alyssa G and Andrea read a couple from corporate that are coming up. Although the first one was for Clinical Command Center. That's a corporate over the whole system. But Ashley Fernandez was a late scratch today. She let me know that unfortunately she's not able to make it and could no longer attend. Felt really bad to miss it. Yeah, Alyssa, did you want to give a quick blurb about hers?
Yeah, absolutely. A shout out is definitely necessary for Ashley, who is a virtual care coordinator on the virtual patient observation team. And her story celebrated her commitment to patient safety as she witnessed a visitor attempting to give her patient a napkin containing an unknown white substance. And she immediately intervened, activating the camera alarm, and she notified the hospital care team so that they could act accordingly to keep the patient safe. So thank you, Ashley, for your patient care.
And if that's a new program, it started, I believe, last year in 2024, and the virtual patient observation, they are there for patient safety. This was not something they would have been looking for, but spotted it and gave the alert. And it's an incredible program that is really there for our safety of our patients. And we congratulate Ashley Fernandez for her role in that. But let's have you go to our next section, Employee Spotlight. This is where a leader stood up and said, I've got to highlight this person's incredible body of work or a special project they're working on. And the first one is for Digital and Technology Partners colleague Anna Weinstock. So welcome back, Anna. Good to see you. And Alyssa, I'll let you share this story.
Wonderful. I'm so excited to congratulate and celebrate Anna today. So Anna Weinstock works tirelessly to ensure the financial operations of digital and technology partners. Oh, we'll just look to mute whomever's on mute.
No, it's okay. It's I think in the background of Anna's. Keep
Oh,
going.
wonderful. Thanks, Anna. So I'll start over. Anna Weinstock works tirelessly to ensure the financial operations of digital and technology partners runs as smoothly as possible. She is always willing to lend a helping hand to her colleagues, ensuring their success with her quick responses, proactive mindset, and collaborative approach. Throughout the complex transition to Sinai Cloud, Anna has gone above and beyond, navigating challenges with determination and expertise. Her efforts may often be behind the scenes, but her impact is felt by all of us. She is someone we can and do depend on, and we are incredibly grateful to have her as a colleague. Please join us in recognizing and appreciating Anna for her outstanding dedication and impactful contributions.
Yeah, thanks. And Anna has been so wonderful and so appreciative to be recognized by her leadership on the huddle. And, I love how your leadership's recognizing how your behind the scenes work is making an impact felt by all of us across our health system. So I'm asking you, what's your personal mission or the sense of purpose that you bring into your work that you'd say, like, this is the impact I really strive to make for our health system, for all the people who work here at Mount Sinai?
Yeah, thank you. First of all, I just want to say how much I appreciate being part of the DTP and the finance team. And I always try to do my best to help my colleagues to get things done correctly and efficiently. I want them to think that we are here to help them whenever we can to make a positive impact. So at the end of the day, it's all teamwork. We work very hard to achieve all our goals, whenever, for any time we can. Once again, I thank you for this honor. It means a lot to me and all of you, the reason I am getting this recognition, and I thank you.
Wow, really wonderful, Anna. The teamwork within digital and technology partners is so critical. And it's your commitment to teamwork for caring about all of the colleagues, everyone who works at Mount Sinai. 48,000 people are impacted by the work of DTP, and it takes a team to support that team. And so thank you for recognizing them and recognizing that bigger picture.
Thank you. Thank you.
All right. Thank you so much, Anna. And thank you, Alyssa. Next, we're going to go to Brooklyn for a pair. We have stories that come from leadership of supply chain and then leadership of laboratory are our next two stories. And they both chose someone from Mount Sinai, Brooklyn, out of anyone in our health system. So let's go first to supply chain who recognized Courtwright Clark out at Mount Sinai, Brooklyn. All right, Courtwright, you're looking great. Get your lighting all set. Katrina, let's have you share this story for Courtwright.
I'm happy to present Courtwright Clark, who is a materials handler at Mount Sinai, Brooklyn, and is a shining star, who is thoughtful, hardworking, and always willing to go above and beyond, not just for the department, but for everyone he encounters. He communicates with his coworkers and leadership through text when items are not coming in or are close to expired or any other issues he encounters. He was recently seen passing by an elderly visitor in the halls and asked if they needed a wheelchair, which he then received and personally escorted the visitor to the unit. He sets an example to all those around him and is often praised by other departments, such as Frederick Cheatham, who is our Director of Food Services, from Courtwright's previous Department of Food Service. He recently stated, "I wish I had 20 versions of Courtwright working at Mount Sinai, Brooklyn." Thank you, Courtwright, and we're so glad to celebrate you.
Yeah, thanks, Katrina. Courtwright, I got to tell you, your story was the hardest to place because there was a story of excellence jumping in to help this patient that you realized could use some help with the wheelchair. You had appreciation by colleagues with Frederick Cheatham wanting 20 of you in his department and giving you a shout out. And just the overall body of your work, people, leaders, recognizing that you are just consistently excellent. And I'm wondering if you can share what is the commitment you make or the values you live by that are leading to this high praise from supply chain leadership, from other departments at Brooklyn that they really appreciate in you.
Well, it all started like me growing up from very young, watching my mom, my grandma. They always trying to like help everyone in the community. So I kind of bring that mentality to work, like, because it's all one. So what it is, like, I just don't say like, hey, this is just my job only to just put away supplies. I say, you need help, I offer help. That's all. That's what it is. And thanks to Freddie also shot that out too.
And I'll add the personal note. Courtright treats everyone like family here in Brooklyn.
Yes.
Well, and it's inspiring to hear where that comes from, to recognize you had role models that cared about their community, and seeing that
Yes.
and growing up and saying caring about others is important. And I don't know what you think. It sounds to me like that's how you ended up in healthcare. That it led to
Yes.
you to have this family background that cares about people and led you to coming into such a noble profession of caring for others.
Yes, it is. Yes. Thank you.
Absolutely. Well, thank you so much, Courtright. Thank you to the
You're welcome.
Brooklyn leadership who shared this story with you and with all of us. And have a great rest of your day. Thank you for all you do.
You too. Thank you.
All
Thank
right.
you,
Thanks,
everyone.
Courtright. And Katrina, we're going to keep it with you. Zhen Chao Ren is from our laboratory leadership recognized. He's a laboratory supervisor out at Brooklyn. So let's hear the story for Mr. Zhen Chao Ren.
So Mr. Ren was exceptional in overcoming two recent critical challenges. His seamless management of the migration of the laboratory information system from SunQuest to SCC was exemplary. Coordinating such a significant transition with his collaborative teamwork and meticulous attention to detail ensured a smooth process with minimal disruptions. Additionally, Mr. Ren's quick response and agility in addressing the blood bank supply interruption due to a New York Blood Center related issue were invaluable. He effectively coordinated with suppliers and pathology leadership to maintain inventory, ensure communication, and guarantee continuous care service, which had a profound impact on Mount Sinai Brooklyn Labs blood bank operations. We thank Mr. Ren for consistently going above and beyond and for handling both of these critical tasks with efficiency and an unwavering commitment to the pathology department's success.
All right, and thank you so much. I'm going to give you some agility on one of those stories and some "we find a way" love as well, Zhen Chao, because one story was a planned migration and how you handled that specific task, and another one was kind of an impromptu response to an interruption for the blood bank supply. Through either of these, can you describe, as a laboratory supervisor, the sense of purpose and commitment you bring into your work that guides your exceptional efforts, as we see in both these types of examples of how you problem solve and find a way?
Yes, thank you, Steve and Katrina. First of all, it's a great honor to be here. In fact, roughly 70% of all clinical decision depends on laboratory testings, which help to diagnose, monitor, and treat both common and complex conditions. We have an amazing team here in Mount Sinai Brooklyn Laboratory. We are putting our patient first, which always been at the heart of what we're doing here on a daily basis. Our role is to deliver answers to the patient most important health questions on timely manners. So day in and day out, we do our best to help deliver the most accurate, timely laboratory testing results to the providers.
Well, thank you so much. I thank you for recognizing your team as their supervisor and recognizing it takes this team to do this, and just you connecting it to the patient. Like, we're here for the patients. We're making sure that it's accurate, correct, that there's a patient at the end of this. And, we hear so often that commitment is recognizing the patient and being able to bring that in to inspire the great effort and action. So thank you for making that connection for us as well.
On behalf of the team, I hear so much about Mr. Ren, especially when Sandy was out. So you really tie in your team well, and you're a great asset to our lab.
Well, thank you so much, Katrina. And thank you, Zhen Chao Ren, everyone. Thank you so much. Excellent. We're going to go on next to another line of service, support and ancillary services leadership. For the whole health system, got to choose one person to recognize. There's so many that fall under this category for support and ancillary services. They chose Judith Guerra from Mount Sinai Hospital. So I'm going to go to Colette Watson. Come on back from Mount Sinai Hospital. And let's bring Judy on screen for this story.
Thank you so much, Steve, and congratulations to Judy.
You can continue. We're going to bring Judy on up.
All right. So let's read Judy's story. So for the past 20 years, Judith Guerra has been a dedicated member of the transport department, earning a reputation as a natural leader and role model. She's always the first to test new processes and provide valuable feedback, making her a trusted resource among her colleagues. One standout example of her initiative was during the implementation of linen cart transportation from the department to inpatient and ambulatory locations. Judy worked closely with management and fellow transporters to gather feedback and suggest process improvements. Recognizing the challenge in locating certain linen carts, she took the initiative to document their locations by taking photos and providing clear directions. She then created visual cues and attached them to the carts, ensuring any transporter could find them easily. Judy's dedication and problem-solving skills make her an invaluable member of the patient transport team, and we are grateful for her many contributions. Thank you, Judy.
All right, thanks, Colette. And we're not seeing Judy, but I see her backstage. She's off mute. She's ready to talk by phone. So sorry. If you want a nice visual of Judy, she submitted her photo. You can find it in our program and in the resources section. But Judy, I know you're out there. So can you let us know after we hear this story? I love how it talks about you being a pioneer to test, to study, to improve new processes in your department. What gets you excited to be a pioneer and take on these new developments for your team?
Well, I'm always eager to achieve personal and professional growth. When I see problems, I try to fully understand them and then develop a plan to benefit my coworkers and other departments that have to collaborate and always rely on my teamwork.
Boom, there we go. I'm going to go to teamwork, but I love the story, Judy. And thank you for sharing to be a leader and to take your 20 years of experience. Congratulations on that as well. And thank you for 20 incredible years here at Mount Sinai and to take that being a veteran status seriously and becoming a leader and using that experience to help with the future of the department and the great work that you do. All right, Judy. Okay. Well, thanks so much. And Colette, I think we're going to stick with you for our next story as well. It was facilities leadership recognized a leader out at Mount Sinai Hospital, Alcy Luciano. So let's bring Alcy up and I'll let you take this story.
Sounds great. Congratulations to Alcy. So the story reads, as a director of planning, design, and construction, Alcy Luciano has completed renovation projects of all sizes with great success at our Mount Sinai Hospital campus and has developed a reputation as somebody who cares and can be counted on no matter the task. Recently, Alcy and project manager Sergio Echeverria took over the GPC TICU space for a full cosmetic refresh, including new flooring, paint, patient head walls, and the outdated nurses station. The team was successfully able to complete this work in about 3 weeks, which was absolutely vital for the hospital due to the current census. Alcy and his team are always looking for ways to safely execute projects quickly, while also considering the needs of the end users and patients. Alcy continues to be a very big part of who we are and fully embodies the One Mount Sinai thought process.
Yeah, there's our One Mount Sinai reference. I also think your badge clip says that we find a way, isn't that? If I'm seeing it correctly. And that's what you and your team are doing here, Alcy. And, it sounds like leadership's very happy with the excellent work on this particular project. So congrats on that. But I also love that they recognize that you've developed a reputation in your career here as somebody who cares. And can you tell us a little bit about that for you, about how you care and the sense of purpose and pride that you bring into the many projects you and your team work on at Mount Sinai?
Thank you. And obviously it's a pleasure to obviously being recognized, planning design construction, obviously with Tina as well. Again, patient safety and care is always going to be our top priorities. And we take pride in what we do, especially when we're building these spaces, because we do want the staff to take ownership and pride in the spaces that we are building and constructing. Yes, construction and hospitals don't mix that well, but we find a way. We find a way with a lot of support. It does take a lot of effort, a lot of coordinations. We always get very excited from the moment that we are communicating these new projects. But I'm also very mindful and letting people know that, hey, you're gonna love us today, but you're gonna hate us for a few months.
Yeah.
if not a few years. But then again, looking at their faces and their satisfaction when we turn over the spaces and see that the work that we have done, pretty much people take pride in, and it's great. With that being said, none of this will be possible without the relentless dedication of our project managers. We have an amazing team of project managers that support us. They are a driving force behind these projects. They do a lot of coordinating and moving pieces, managing challenges, which enabling, especially in spaces that are not growing, actually they're shrinking, brings a lot of decisions to be made. And obviously ensuring that we deliver on time and our standards for the patients and staff that they deserve. I'm proud to share this recognition with them
Yeah.
and with many departments across Mount Sinai who make our work possible. So
Yeah.
thank you.
Well, thank you, Elsie. So well said, and so funny to hear you say, okay, so the arc is they love you when they hear the project is going to happen, then they dislike you a bit, frustrate West the project's ongoing construction projects, but then you know that end in mind is they're going to love this space. That you can picture not just what this is going to be for our patients, but to know that these employees are going to be proud to be in this new, fresh, wonderful space that you've put your heart into and your effort into to create for them. And to see that satisfaction and seeing them enjoy this new space that drives you is so inspiring to hear. I just love it. So
Thank you. Thank you.
thank
We
you to
do also
you.
try challenges, but we make it work.
But you find a way.
We
So
find a
thank you to
way.
you. Thank you to your project managers you praise. Thank you to your whole team. Great work. All right, thank you, and thank you, Colette. We're gonna go back to Andres Barrera. Let's go. We're gonna go to West and Morningside for the next three. So Andres, get ready to go. Thank you for those stories, Colette. Let's bring on Andres for the next few, and we're gonna start at radiology. Shondell Sinchi from Mount Sinai West was recognized by radiology leadership. So let's bring Shondell up, and you can take it away, Andres.
Wonderful. So, Radiology Associate Director Shondell exemplifies exceptional leadership and unwavering dedication by ensuring seamless operations. Even with difficulties in hiring additional radiology techs, she has creatively managed resources through her hands-on approach, often stepping in herself to take images, start IVs, and maintain patient flow, showcasing her deep commitment to both staff and patient care. Shondell's positive attitude and willingness to lead by example have made her a trusted and respected leader among her team. She fosters a culture of collaboration, engagement, and accountability, ensuring her staff feels supported and safe. Shondell consistently goes above and beyond for her team, with many expressing their deep appreciation for all her hard work and dedication. Her commitment to excellence, patient advocacy, and commitment to Mount Sinai's values make her an invaluable asset to the organization. Congratulations, Shondell.
Thank you
Yeah.
so much.
Thank you, Andres. Shondell, I gotta give you a shout out. If anyone missed yesterday's patient experience forum, Andres was involved in that. Colette, who just spoke, was involved in it. Erica Rubenstein and all their team. It was an excellent forum about a patient story that came on and shared. Very emotional. They're gonna have a recording and link. I suggest everyone check it out. It was a really wonderful PX forum, and I know I saw you in the chat cheering on your team, the people
Yes, I
working
had
in
to, of
radiology.
course.
So I'm so glad that you can now be highlighted. And this story is a shout out to your hardworking and collaborative team as well. So can you tell us a bit about your team in radiology and the values and the sense of purpose that you help embed into the culture of the department that is getting such great success with that team and for our patients?
Absolutely. Thank you so much. Yeah, I have an amazing team. Everyone has, come on at different times since we opened the center in October, but everyone has worked so tirelessly, from our patient coordinators and our breast coordinators, who are the first point of contact for our patients. Our imaging supervisor, Tiffany Jennings, who has been with Mount Sinai for about 12 years or more. She demonstrates great leadership, empathy, and patient care, and, brings that sense of Mount Sinai's culture to all of our staff members. And then for our technologists, we have mammography, ultrasounds, MRI techs. They've come to us with different skill levels, amount of experience in their field of study, some straight out of school, and they've just been so excited to learn. They're so grateful to have the opportunity to grow their career or begin their career with Mount Sinai. And they enjoy helping patients through a sometimes difficult period in their lives, including breast cancer diagnoses and monitoring. So they just inspire me every day. We all learn from each other, and we really do remind each other how to show up as our best selves for our patients and for each other.
Yeah, show up as our best selves for every patient, every day. And again, I recommend if you missed it yesterday, check out the recording that is going to be shared. It was very, very emotional, very powerful. And just a reminder of the patients, that putting a face and an emotion to what they're experiencing and how you and your team are making a true, meaningful, memorable, life-changing difference in our patients.
Thank you so much.
Yeah, thank you so much, Shondell. Great to share this story. Great to hear from you.
Appreciate it.
Andres, if we're gonna go backwards in the script, we found Dr. John Fair is here. Oh, actually, we're gonna pause you a bit. If Zach Key is here, we want to go to Dr. Fair next. He's coming out of the OR. I believe we were waiting to see when he's able to come back and join us. So if Zach Key is here for this story, we're gonna go back to our appreciation for patients section while we have Dr. John Fair. John, thanks for joining us.
Thanks for having me.
Thank you, Steve. And I will give Dr. Fair a shout out. This is his third time on Beyond the Badge, so I don't know if we have a leaderboard, but he has to be at the top of there.
Yeah, all from
But-
patient letters. They keep writing.
But the story is a patient submitted an email to express their gratitude for Dr. Fair of Mount Sinai, Queens, writing, "My husband, a patient of Dr. Fair, sadly passed away last December. Dr. Fair was very compassionate and professional. Our appointment was always ended with a big hug, which showed us how much he cared. He treated my husband with respect and kindness. It is very evident that Dr. Fair practices the guidelines of service excellence. He is an asset not just to the vascular department, but to the whole Mount Sinai system. Again, from my heart, thank you for his excellence and most of all, his compassion."
Yeah, thanks, Zach. And it's so great during this cap of Patient Experience Week this week to hear a letter from a patient. Dr. Fair, this is a short message of gratitude from a patient's spouse who twice comments on your combined attributes of service excellence and compassion. I'm wondering if you could speak to how you bring these two impactful elements together into every patient and family experience.
Can everyone hear me okay?
Yep.
Okay, great. Yeah, so I mean, this was, a patient who I'd been following for a really long time. And so, it was kind of surprising, after a death to kind of receive a letter like this. And so it was really touching. It really felt it, the impact that we can make on patients, even when the outcome is not what we expect. I think for us, or for me, I rely on the strength of my team. I have an amazing support team in the office between the medical assistants, my coordinator, and my ultrasound tech. We from walking in the door to the end of the visits, I feel like patients really feel like they're cared for. So I can't really take much of the credit because it's really a team effort all the way.
Yeah, a pair of great points, Dr. Fair, and thank you that, even in sometimes when the outcome isn't ideal, it's a poor outcome in the end for the patient, that you're still making that care is making a difference to the families. And they so truly appreciate that level of care and kindness and support that they received. And while they're emotionally struggling through, they still take the time to write is really wonderful and really heartwarming to see. And like you said too, from step one, we heard it from other people. It starts at the beginning of the experience to get that result at the end, and it takes everyone on the team to help create that from moment one throughout the final moment to create a letter that ends up being submitted to recognize you and the whole team.
Thank you so much again.
Thanks so much for taking the time out to join us. I know you have a busy day in the OR today, so thank you. I'm glad you were able to make it.
Of course. Thanks again.
Okay, and thank you, Zach. Big shout out to Zach too. Such great fun. If you're out at Mount Sinai, Queens, the scavenger hunt he's been running for Patient Experience Week. Get your final tickets in here. It's a really creative and wonderful idea that you've all been enjoying out at Queens. So great work, Zach. We're going to go to our final section of the script here. It's for our appreciation by colleagues section. We've got a series of stories that came from peer-to-peer appreciation. I love these. It means that someone out there took the time to write, not just to write an appreciation for a colleague, but wrote something so excellent, so inspirational that a leader saw it and said, I got to share this with everybody. This was so well done. It's such a great note of what excellence looks like at Mount Sinai that I'm taking this star recognition and I'm sharing it at the senior leadership huddle. So enjoy some of these stars, and you can do this. Make a point of it today. It's a nice Friday, beautiful spring day in New York. End your day by writing a star. We have links for it in our resources tab. Send a message to a colleague and put some real thought into what they're doing that is really aligned with our values that you appreciate and value yourself. I don't believe we have Karen here just yet. Andres, come on back up. We do have Jacqueline Garcia here from Mount Sinai West Ambulatory, and we'll keep our eyes out for Karen if she's able to make it. But let's go to Jacqueline's story from Mount Sinai West Ambulatory Leadership. Hi, Jacqueline.
Hi.
All right, Andres.
So Jacqueline Garcia is an amazing secretary in the Mount Sinai West neurology practice. Jacqueline always makes sure that her patients are prepared for their visits, are confident going in, and she stays as long as it takes to ensure all her patients are tended to. Jacqueline is also an asset to her practice and the team members around her. Her manager shared, quote, Jacqueline is resilient in her day-to-day activities and a rock for our team. We all know we can count on her to bring a smile to her peers and patients. Jacqueline constantly celebrates all her team members and makes sure that during milestone moments from birthdays to baby showers that they feel supported and celebrated. Thank you, Jacqueline, for going above and beyond. We're so grateful to have you in our Mount Sinai West ambulatory team.
Yeah, thank you. Somebody wrote this on your behalf, but it sounds like the whole team's behind it. They all believe it and appreciate you, and they're writing with the spirit of everyone wanting to take a pause in their day and say, we need to let Jacqueline know, and thank you, and make it public. So I'm wondering, Jacqueline, what is the commitment that you bring into your daily work that helps you provide not only excellent experiences for your patients, but also for your neurology colleagues?
Oh, wow. So I've been working for the institution for 23 years for the same department, and I love my department. I love my patients. Some of them could be challenging, but that's what I love the most of it. I love my staff. I love my coworkers. So every day when I come in, my attitude is, okay, what could I do to make a positive role for my patients and for my staff? So I'm always smiling. I'm always alert of things of patients. If a patient is sad, I try to bring joy to them, whether it's just a smile or just have a conversation. I make sure that my providers has everything that they need to assess the patient when they come in, and they feel very comfortable when they leave the doctor's office. So, I mean, that's about it. I just love my job. For 23 years, it speaks for itself. So I really do love my job, but I do like to celebrate people's life. I am grateful that God give us another year alive or any celebration, and I think everyone should be celebrated for that. That's it.
Beautiful.
Simple.
Jacqueline, beautiful, so beautiful. And I love to think for 23 years that every single day you recommit to saying, what can I do today to make a positive difference on my patients and on my colleagues? And for 23 consistent years, clearly that hasn't faded, that your colleagues are saying thank you to you today, that you're able to recommit to that. And noticing that it's the little things, a smile, just listening to them sharing the story, that these are the things that can make a positive difference. And I'd love to hear more some other time, that you like the challenging ones. That like when you have a challenging situations, that's what you love, to be able to find a way
Yes.
and make a difference for them.
Yes. Yes.
Yeah.
Yeah.
Really inspiring, Jacqueline. Thank you so much. We're so glad we got to share your story. Thank you to your team who wrote it for you to bring it to our attention. And thank you for sharing your very inspiring insights.
Thank you. Thank you. I really appreciate it. I'm very humbled.
Thank you.
Bye.
Okay. Andres, we're gonna come back to you if we see Karen in a bit, but I believe we have Nancy Alvarez ready from Mount Sinai Union Square, and Ellie Park from Union Square is gonna come on and read this peer appreciation that we received for Nancy.
Thank you, Steve. Good afternoon, everybody. Congratulations to all of our amazing staff for being celebrated today. I'm proud to introduce Nancy Alvarez for her celebration this afternoon. Our colleague writes, cardiology is a fast-paced, high patient volume department. Yesterday, Nancy Alvarez, a recent RN graduate, faced two challenging situations, both resulting in emergency transfers. During both situations, Nancy kept her composure, alerted the team, and implemented her critical thinking skills. Nancy, great job. Thank you for your quick thinking and for keeping our patients safe. It's a pleasure having you on our team.
Here we go. Keeping patients safe, key priority, value number one. And Nancy, your colleague recognizes that it's your composure and your quick thinking in the face of a challenging situation that they wanted to highlight. And I'm wondering if you can tell us about that approach. What is the mindset that helps you perform so effectively and confidently in challenging or emergency situations?
Yes, first of all, thank you. I feel honored to be here today. And responding to your question, knowing that I have the support from my manager, Krista Patterson, and the support from the entire healthcare team. So that gives me the confidence to act appropriate during difficult and challenging times. And knowing that patient care is the priority. I think that we are here to deliver the best nursing care possible and to provide excellence in patient care and safety.
So what I'm hearing, which is so wonderful, is understanding and taking pride in knowing that this is at Union Square and at Mount Sinai, that commitment to excellence for our patients and excellent patient care is there, and taking stock in that commitment and being proud of that and wanting to deliver that is the important. But what it takes is understanding you've got the support of the team and a
Support.
manager who says, I believe in this. This is what is important to me. And knowing that you've got that support to do your best is also critical. So really wonderful to hear. I'm glad you have that support. And to all the managers out there, recognizing that lesson, knowing that your support matters and is making an impact in our patients. Thank you so much, Nancy. Really wonderful. And thank you, Ellie. Okay, I'm keeping my eye out just in case anyone arrives late who wasn't able to make it. But otherwise, I'm going to our big finale. We have Dolly Chan from the Network Practices who is ready. And Zoe Long is going to share this story for Dolly, who's been eagerly awaiting her turn since I saw her early this morning getting set to go. So Dolly, we're up to you. Here we go.
Hi, congratulations to all the honorees. So for Dolly, the director of Mount Sinai Jackson Heights expressed their appreciation for Queen's clinical manager, Dolly Chan, for her exceptional leadership. She writes, Dolly has been working closely with site leadership to meet compliance and quality goals. She has been instrumental in providing clinical trainings to staff, which has improved workflow efficiencies for patients and staff members. Dolly has always been hands-on, which is intuitive to learning. She works closely with all staff and administration to make improvements to help the staff and physicians work smarter, not harder. As a director, I am grateful that Dolly is on our team and shares her vast knowledge. Dolly truly models our core value of teamwork by collaborating across departments, which shows an understanding that we work better together to elevate healthcare for the communities that we serve.
Yeah, thank you, Zoe and Dolly. I love that final line. Let's go right to that this leader identifies how your actions show you understand how we work better together to elevate healthcare for the communities we serve. That's like a mission statement they wrote for you. And I'm wondering if that's the mission statement that you go by. How would you describe your approach to collaborating across the departments, particularly in an area like the network practices, to help elevate healthcare?
Well, I want to start off to say thank you for this incredible honor. And my approach usually starts off with a lot of patience and being very adaptable to whatever the situation is. And it's like early on, it's like focusing on what our shared goal is, making sure we're listening to each other and opening that clear line of communication. And while all this is happening, I'm the crazy person behind researching, seeing what's the best practice. Hey, do we have all our key shareholders, and making sure we're aligning as like one. And then while this is going forward, in between, it's like shifting back to role, like, hey, am I the leader to provide support? Am I your cheerleader to give you encouragement? Or am I just listening? Because we know along the way we hit a lot of road bumps and challenges. But it's like how in the end, it's always like my goal is always let's work smarter, not harder, because there's always challenges coming up. And as we know, change is never easy. And I think it's natural, but I believe a lot of patience and grace goes a long way in making sure that we can collaborate like efficiently and also effectively.
Dolly, wow. So I gotta say, what you just laid out, I gotta go back to the recording afterwards because it's like the outline for a course on great leadership of everything you just identified, honestly. And I'm gonna go back to what Emma said at the beginning about One Mount Sinai, and Dr. McGreevy said it as well. We're as one. And our ultimate goal is one, and then noticing right off the bat, like, what is our shared goal that we're trying to do? And then how can I support it? We just heard how important support is from leadership. And then you recognized how it takes a different role sometimes. How am I needed as a leader in this case? Do I just need to listen? Do I need to be a cheerleader? Do I need to provide best practices? I have different roles as a leader in every different aspect. And to be agile, we'll go to our values here, to be agile for each situation, I need to understand what's the goal and then see what role I can play to help this group get to those best results. A course in itself that Dolly just wrote for us. I really, really wonder. I love it. Diane Adams, our Chief Learning Officer, is commenting on it as well. We'll have to partner on a new program. Well, thank you so much, Dolly Chan, everyone, and thank you, Zoe, for sharing the story. All right. With that, I do want to reference back to the other stories that are in our program. So if you've heard all of these wonderful stories, you've been inspired, and you want to read a few more, give a shout out. You can read about the top-notch empathy, compassion, and care of Nurse Elmi Coste of Mount Sinai Hospital. That's in your program. Also, pharmacist Grace Tam was really so appreciative to have this honor. Couldn't be here today, but her positive and collaborative ray of sunshine at Mount Sinai Brooklyn is how she's described. Mount Sinai Hospital Patient Service Coordinator Jalen Dockery does an excellent job coordinating care specifically for cancer patients with heart disease, a very unique role. You can read that story. Another for Anna Henriquez at an ambulatory care call center and her work, hard work and dedication. And finally, one for pharmacy technician Anna Tiburcio, who took swift action upon discovering a Pyxis machine with signs of tampering and damage. Read all about the above and beyond effort she made to ensure patient safety following that event. So check those out in our program. Otherwise, I want to thank you all for joining us today. A big final recap of Patient Experience Week. Look for their resources and recordings from a great week celebrating the work you do, creating exceptional experiences here at Mount Sinai for our patients. We're looking forward to Nurses Week next week. So for all our nurses out there, enjoy Nurses Month and Nurses Week next week. More great events taking place. And thank you to all of you who keep coming back, particularly our leaders who keep supporting and wanting to come and listen to the stories and hearing the responses, these passionate, inspiring responses by our colleagues. We'll never run out of stories with such a large organization, but each one is unique and special, and there's a person behind them bringing their genuine self into their role every day that is making a difference. So I hope you enjoyed today's episode. Michael's going to put up a little slide here with our next date on June 6th. We hope you can come back. Otherwise, have a wonderful weekend, everyone. Take care.